Hi, this is internet sensation Keith again, back talking to you about how the government should work. Today I'm going to talk about healthcare, and I'm going to talk about one of the most complex problems in our country in about 5 minutes, so we're going to go quick. What's the problem with healthcare in the U.S.? First answer would be expensive. Yeah, but why is it expensive? There's multiple middlemen, there's insurance brokers, insurance companies, the medical suppliers, on and on, lots of middlemen. We do a pay for service versus a pay for results. So lots of tests, lots of expenses may not result in better health care, which leads to more services, more expenses. There's extensive end-of-life costs. There's statistics about a huge percentage of our overall lifetime medical expenses are spent in the last month of our life. That's obviously not a good system. And there's little incentive to reduce costs. So there's a lot of problems with our healthcare system in the U.S. Oh, and I didn't even put on here, there's a lot of people in the country that aren't covered with any kind of healthcare system. Where does this fit into my overall agenda? This fits into the trying to be fiscally responsible, eliminating wasteful government spending, and trying to make the average citizen's interests my first priority. What are some potential solutions? The current system, you can stick with the current system, no change required, it's expensive, doesn't produce great results, and there's huge end-of-life costs. You've heard of Medicare for All. Everyone gets covered. You close the insurance gap. It's a big change. America hates big changes. It's very expensive. Probably won't improve results because you're just not changing anything fundamentally. You're just moving who pays for it. And really, do I trust the government to run this? I've heard of a lot of pay-for-results plans that kind of flips healthcare on its head. I've only seen conceptual discussions of this, nothing on how it would really work at a detailed level. Not clear if it's cheaper. And some people want to privatize Medicare, Medicaid. Probably cheaper, probably reduce services. So what's Dr. Keith's ideal healthcare policy changes? Reduce the profits of the middlemen. This will drive people insane, but you've got to think of healthcare more as a utility than as private industry. Anyone who thinks that healthcare right now is capitalist, free market, private, is not paying attention. There's so much government intervention in it, so much government involvement in it. So treating it as utility will drive a lot of people insane, but it's not out of the question. That way you reduce profits of middlemen, you squeeze some of the costs out of it, squeeze some of the huge costs out of it. Limit end-of-life costs. I don't know how to do this. It reduces overall healthcare costs, and it would make me the most unpopular man in the world. This comes back to death panels and things of that sort. I'm not suggesting death panels. I'm saying that there should be a way for us to address end-of-life costs. I don't know how. It's not a very popular subject. Pay for results, flip the premium upside down. Sicker patients pay less premiums, and well patients incentivizes preventive medicine. Cost reduction incentives, tax breaks. If the industry is an overall entity, reduces healthcare issues, achieves better healthcare, tax incentives. So again, you're incentivizing, a lot of this is incentivizing the industry to produce better healthcare. And I do believe you need to expand Medicaid to include all Americans, close the insurance gap. That's my ideal healthcare policy. It's going to cost some money, and there's no doubt about it. What would how would that break down into specific policy initiatives? No executive orders. I think we've shown that you've got to get bipartisan support on healthcare or it's not going to work. I would look at it as nothing in the first 100 days, 2 bills, one in the first 2 years, one in the second 2 years. The first healthcare bill, take a smaller bite at the apple, cost reduction, tax incentives, close the insurance gap. The second healthcare bill, again, try to build trust of the American people. You don't take the big bite first, take the small bite, build trust, take the big bite second after you've built the trust. The second bill would be utilitizing, turning the healthcare industry into a utility, limiting end-of-life costs, and implementing a pay-for-results model. And those would be the kind of the big bites of the apple. Final thoughts on healthcare in the Dr. Keith administration. Fixing healthcare requires a complex set of solutions that will impact everyone. If you really fix healthcare, everyone's going to be a little upset. Believe me when I tell you, no one in Washington wants to fix healthcare. Giant healthcare companies fund the politicians. Giant healthcare companies make giant profits. One of my rules of life is if the money is flowing, change is not coming anytime soon. The money is flowing in healthcare, so you're not going to see change anytime soon. Everyone would have to give a little to make it work. Insurance companies would have to reduce corporate profits, would have to change to more of a pay for results model. Citizens would have to buy into the concept of reducing end-of-life services, more responsibility for their own health outcomes, and the government would have to improve regulatory oversight and tax policy around healthcare to create incentives for the insurance industry. So everyone would have to give a little, everyone would have to do a little. No one's going to do that. Washington's not going to fix healthcare anytime soon. A Dr. Keith administration would at least try. Next time I'm going to talk about the debt and the deficit. And again, I'm a independent, and I'm not voting for Democrats or Republicans anymore. I don't think you should either.